As part of our ongoing research in support of UNICEF on the social and economic impact of the COVID-19 pandemic on children and their families, we conducted 2 studies between October and November of 2020 to assess the ways in which children in Ethiopia have already been impacted by the pandemic, with a particular focus on the most vulnerable. But first, here's a quick recap of the major ways in which children and their families are affected by the COVID-19 pandemic. As a respiratory virus, the first and most obvious channel of primary impact of the COVID-19 pandemic is on human health. Although risks to children's health have been statistically lower, research is ongoing regarding children with pre-existing poor health conditions in low-resource settings. Nearly all children are, to some extent, affected by the secondary channels of impact. Pandemic management policies disrupt essential services for children such as health and education. Lockdown measures, social distancing, and school closures contribute to not only the interruption of services and financial shocks to households, but also disrupt the social fabric of societies. There are also social and behavioral effects, including changes in consumer demands and a rise in fear, isolation, and stigma. These impacts are interlinked and altogether contribute to a worsening of child poverty and inequality, children's health and nutrition, access to education and learning outcomes, child protection, care, and participation. At the same time, poor preconditions including poor access to proper hygiene and sanitation for pandemic management, poor access to information, and a lack of access to social protection and assistance exacerbate these outcomes and deepen existing inequalities. These impacts are altogether compounded by pre-existing vulnerabilities such as disability, reliance on informal work, poverty, and living in a remote area. Now, let's consider the case of Ethiopia. By February 2021, Ethiopia has seen about 21,000 active cases out of a total of nearly 160,000 cumulative cases of COVID-19 in the country. The vast majority of these cases have been in Addis Ababa. The government of Ethiopia has enacted a number of responsive, mitigative, and preventive measures, including travel restrictions, lockdowns, social distancing, and school closures. Among the widespread social and economic impacts of the virus and related measures, 26 million students have been out of school, out of which 1 million have lost out on regular access to school meals. The country's GDP is also projected to contract from 2 to 10% by the end of 2020. Nearly 30% of the population are estimated to need social assistance. In support of UNICEF, we aim to assess the impact of the COVID-19 pandemic on children through a quantitative phone survey in Addis Ababa and qualitative studies in 2 regions that have among the highest prevalence and severity of multidimensional child poverty in the country, Amhara and Somali. This part of the presentation will focus on the findings of the quantitative survey in Addis Ababa. Already before the pandemic, 1/4 of all children in Addis Ababa were found to be multidimensionally poor, and 1/3 of all children lived in monetarily poor households. It's important to note that while the number of COVID-19 infections were highest in Addis Ababa, this region also fares much better compared to other regions in Ethiopia with the lowest headcount rates of poor and deprived children. This suggests that the effect of the pandemic on the vulnerable are likely to be worse in other parts of the country. Our survey was carried out by telephone and included a sample of 241 households with children and a total of nearly 500 children. In terms of the effects on children's health and nutrition, our survey found that following the pandemic, there had been significant disruptions to access to antenatal healthcare services, to the amount and quality of meals that children received, as well as interrupted access to school meals. Households most frequently cited income decline and rising food prices as the reason for these changes. Following school closures, the government implemented a distance learning plan to provide remote learning opportunities to children through TV, radio, and other digital platforms. However, children's school performance and engagement in education still suffered. Many schools also did not organize compensatory learning activities. Although most children in Addis Ababa will return to school, this will likely not be the case in other parts of the country where inequitable access to education and distance learning are still a problem. For infection prevention, the government has made efforts to improve access to and knowledge of water, sanitation, and hygiene practices in Addis Ababa. Access to wash services in Addis Ababa are among the best in the country. However, 44% of households still cited frequent water shortages and lack of clean water nearby as barriers. Children have faced higher risks of exposure to vulnerable conditions at home as an indirect result of financial shocks and increased time confined at home during school closures and during lockdown. Respondents of their survey noted an increase in domestic violence, abuse, and protection violations at home following the pandemic. Girls and boys also face differential risks such as to child labor, domestic chores, FGM, and child marriage. We explored these topics more deeply through the qualitative research in other parts of the country where these are particularly prevailing issues. Our survey sample also included equal representation of beneficiaries and non-beneficiaries of the Urban Productive Safety Net Project, or UPSNP. Especially due to the economic impact of the pandemic, social assistance will provide an important safeguard against poverty and to build resilience of households in times of crisis. During COVID-19, 90% of households received their UPSNP payment every month. 10% did not, and 7% received irregular payments. Face-to-face activities also decreased as a preventive measure against the pandemic. Those who did receive support through the UPSNP mostly received personal protective equipment against COVID-19 infection, forms of cash transfers, and information around COVID-19.
This part of the presentation discusses the key findings of the qualitative research component that was carried out for this study to find out what was the impact of the pandemic on utilization and provision of basic services. The data were collected during November 2020 in the regions of Amhara and Somali and involved key informant interviews with service providers in the sectors of health, nutrition, education, WASH, and social services. Amhara and Somali rank among the two poorest regions in Ethiopia in terms of multidimensional child poverty and in incidence of children's deprivation from basic needs and services. Key informants in both Amhara and Somali stated that there was a sharp decline in utilization of health and nutrition services in the first months after the outbreak of COVID-19. The most common reasons for this decline were stated to be fear from contracting the virus and misinformation that spread in the communities. Informants reported no major disruptions in delivery of health and nutrition services since the outbreak of COVID-19. The only exceptions were outreach activities like immunization campaigns and health education activities that require travel and community gatherings, both of which were prohibited during the lockdown period. Lack of financial resources was cited as a major impediment to health service delivery, as the already constrained budgets of health facilities had to be reallocated to purchase of PPEs for their staff. Schools and Voredas faced several issues with arranging distance learning during school closures, among which a lack of technological infrastructure, lack of training of teachers, shortage of teaching and handout materials, and lack of financial support in general. From the perspective of children, attendance was hampered by lack of motivation and limited or no follow-up by the teachers. In Somali, children could not attend distance learning classes due to lack of electricity or information devices in their homes. One of the first arrangements that the schools in both regions made for reopening was to reorganize the classrooms in order to meet the standards for physical distancing. In Amhara, renovations were made to wash facilities, whereas in Somali, this was rather challenging. Somali also faced a difficulty in distributing masks to all the pupils and students in the region due to shortages that they faced in the supplies. In both regions, the key informants in the education sector reported that they are facing difficulties in ensuring that pupils follow guidelines and preventive measures against COVID-19 infections. Key informants from both regions reported an increase in school dropouts since reopening. One of the most commonly cited reasons was financial hardship caused by the pandemic, resulting either in children's engagement in economic activities or in inability of households to afford uniforms and other school material. Fear of COVID-19 infection was the second most commonly cited reason, whereas in Amhara, child marriage and pregnancy were also considered impactful. Key informants across all sectors in both regions reported an increased violation of child rights since the onset of the pandemic. These include an increased prevalence in child marriage, of female genital mutilation practice, child labor, gender-based violence, sexual violence, and so forth. On the other hand, no new services were introduced to tackle either existing or new vulnerabilities, and there has even been a reduction or suspension in existing counseling and community visit activities. Unlike in the other sectors, there are major differences in service provision in the sector of WASH between the two regions. In Somali, no interventions took place since the onset of the pandemic because of travel restrictions and physical distancing. So no new water sources or hand washing facilities were developed, and no community engagement took place. In Amhara, the opposite was the case, and many examples of intersectoral collaboration for awareness raising were provided by key informants. However, all these programs and activities have been challenged by a shortage of administrative and financial resources over time.